If you're on Ozempic, Wegovy, Mounjaro, or Zepbound, any of the other GLP-1 medications, and you're heading toward a hip or a knee replacement, this video is for you. My name is Dr. Blake Peterson. I'm a fellowship trained and board certified orthopedic surgeon. I specialize in hip and knee replacement. And today I'm going to talk about GLP-1 medications. GLP-1 medications are changing our environment so quickly. We're seeing patients who have struggled with weight loss for the longest time be able to finally achieve their weight loss goals and make for potentially safer and healthier surgery as well as lifestyle. That doesn't come without risk, though. And one of the things that we talk about a lot is the perioperative risk that is involved. So when you take a GLP-1 medication, such as the ones that I listed, this slows the rate at which your stomach is emptying its gastric contents. This is important when it comes time for anesthesia. You've probably heard the recommendation of nothing to eat after midnight, nothing to drink after midnight. The reason that exists is it gives you at least 6 or 7 or 8 hours before you have that operation, and you end up having all of your airway and stomach and upper GI tract relaxed, trying to avoid what's called an aspiration. That's where your stomach contents may come upwards and go down your airway. That would be a very, very bad deal when you're having an anesthetic, when you're being intubated for a surgery. So in order to do this, we want to make sure the stomach is as empty as we can before we have surgery. GLP-1 medications make that 6 to 8 hour window maybe not enough time to empty those contents completely. So the most recent recommendation is to try to get those effects of the GLP-1 medication completely out of your system before we induce anesthesia. Most recommendations will say now to go 14 days before your surgery between that and your last shot. The recommendation used to be 7 days, but it feels as though some of the more recent studies are now suggesting 14 days might be the most effective and safe way. A 2-week hiatus from your GLP-1 medication is not going to stop your weight loss. It's not going to make your diabetes be completely uncontrolled. It's going to make for where you can have a safer surgery. Another piece of this equation that's very relevant in orthopedics is what happens to your body over weeks and months or years on these medications. Rapid weight loss on GLP-1 medications don't come exclusively from fat. That means you're losing other tissues which are perhaps more vital, things like muscle and bone. So the recommendation when you're on these medications long-term is to maintain a strength training program and weight-bearing exercises. So walking or running and lifting weights or doing resistance exercises is even more important when you're on GLP-1 medications because you're helping restore or retain that muscle strength as you go through that weight loss journey. So does this change your outcome? Does this change the result of your surgery? Does it make your surgery more successful? Does taking a GLP-1 medication actually change what happens as a result of your orthopedic surgery? The honest right now is maybe. It depends on what you're measuring. Some recent reviews looking at joint replacement and spine surgery found that GLP-1 medication users had lower rates of reoperation, lower readmissions, lower blood clots, and lower pulmonary embolus or blood clots that travel to your lung. All of those sound like great things. These are all things that occur because of the benefits of better metabolic control, lower body weight. Some of these reviews also found higher rates of kidney injury, higher rates of pneumonia, and some patients had higher rates of blood clots. So that's a little bit of a contradiction depending on what study you're looking at and what result you're looking at. This is genuinely new area of research. This is an area we don't have a clean answer yet. And I think that you could probably design a study to give you whichever answer you're trying to find. So as we get larger studies that have much more widespread patient populations and collect more and more patients, I think we're going to have a clearer idea of what the true end result is. I think it's well known, though, and I think it's generally accepted that patients who are having surgery at a healthier weight typically do better. It's just how far do we go in one direction or the other to be safe and effective. So what do I actually tell my patients? This is the bottom line that I want you to take away from this video. If you're on a GLP-1 medication and you're having orthopedic surgery coming up, please make sure everyone from the orthopedic surgeon to the anesthesiologist to the nurses taking care of you know this. It's incredibly important as you plan ahead for that surgery to be sure that you're off that medication at least 14 days prior to that surgery. You need to follow specific instructions with your surgery team, talk about the different medications you're on, be sure that they know every medication you're on, whether it's prescribed or you're buying it as a cash pay, or you're using a compounding, it's very important to be sure that you're letting your providers know what's happening in all aspects of your care. If you're one of the many patients that are out there that are trying to lose weight to optimize yourself or get yourself more eligible for an elective orthopedic surgery, I think it's important to be sure you're working with a healthcare provider, whether that's an endocrinologist, a weight management specialist, your primary care doctor, or some of the specialists in orthopedic offices. I think this is incredibly important that someone is looking at your entire health, being sure that you're maintaining good muscle strength throughout this weight loss journey, being sure that you're staying hydrated, because this medication does make you not as thirsty, not as hungry, so you're more likely to be dehydrated and cause kidney issues. Tracking all of these things, tracking your labs throughout this journey is incredibly important. So it's not something you just take and just hope that the medication is going to work with no side effects. You have to be cautious. You have to be careful and proactive about your health throughout this process as well. If you have more questions about GLP-1 medications and their use, as well as the effects and benefits for orthopedic surgery, leave a message in the comments below. Be happy to pull some of those out and make another video to answer some of those, and I'll answer in the comments below as well. Please like and subscribe, help make more videos like this.